Have you noticed something strange after the age of 35? Even if your weight hasn't changed much, your belly slowly starts getting bigger. And many people ask me the same question. Doctor, why is belly fat suddenly appearing after 35? The truth is, the reasons are different in men and women. Let's start with men. First, an important warning sign doctors look for. If a man's waist size is more than 102 centimeters or 40 inches, it significantly increases the risk of metabolic syndrome, a dangerous condition linked to heart disease and diabetes. So why does this happen? The first reason is declining testosterone. After the age of 30 to 35, levels of testosterone gradually start falling. Lower testosterone can lead to increased abdominal fat, reduced muscle mass, slower metabolism, less energy to exercise. Doctors sometimes call this late-onset hypergonadism. The second reason is visceral fat. Men tend to store fat deep inside the abdomen around the organs, called visceral fat. This type of fat is strongly linked to diseases like type 2 diabetes, cardiovascular disease, and fatty liver disease. Even men who look thin may develop what doctors call central obesity. The third reason is insulin resistance. With age and reduced activity, the body may develop insulin resistance. This causes increased belly fat, strong sugar cravings, higher risk of type 2 diabetes. Another major factor is stress. Chronic stress increases the hormone cortisol, which directly promotes abdominal fat storage. Common triggers include work pressure, lack of sleep, and financial stress. Alcohol also plays a big role. Regular drinking leads to the classic beer belly. Alcohol adds extra calories, increases visceral fat, and can cause liver fat accumulation, leading to non-alcoholic fatty liver disease. Another hidden reason is muscle loss with age. After 35, muscle mass gradually decreases due to sarcopenia. Less muscle means the body burns fewer calories, making fat gain much easier. And finally, sleep deprivation. Poor sleep disrupts the hormones that control hunger. Levels of ghrelin increase, making you feel hungrier. Levels of leptin decrease, making you feel less full. The result? Overeating and more belly fat. Now let's talk about women. For women, the biggest reason is hormonal change. As women approach their late 30s, the body slowly enters early stages of perimenopause. During this time, levels of estrogen begin to decline. This shift causes fat distribution to change. Instead of storing fat around the hips and thighs, the body begins storing more fat around the abdomen. Another factor is slower metabolism. As we age, the body's basal metabolic rate naturally decreases. This means the body burns fewer calories at rest. Muscle mass slowly declines. Fat accumulates more easily. Stress also plays a big role in women. High levels of cortisol can cause belly fat, sugar cravings, poor sleep, and weight gain, even when dieting. Another hidden cause is insulin resistance, which becomes more common with age and leads to increased abdominal fat and higher risk of type 2 diabetes. Thyroid problems can also contribute. Many women develop hypothyroidism in their late 30s or 40s. Symptoms include weight gain, fatigue, puffy face, and hair thinning. Sleep problems also worsen belly fat. Poor sleep increases ghrelin and reduces leptin, leading to increased hunger and overeating. And finally, reduced physical activity. Busy schedules with work and family often leave little time for exercise. This leads to muscle loss and increased fat storage. That's why strength training becomes extremely important after 35. So, if you are noticing belly fat after 35, remember, it's not just about eating more. It's often hormones, metabolism, sleep, stress, and muscle loss working together. Understanding the cause is the first step to fixing it. For more information videos, like, share, comment, and subscribe to Dr. Central.